Welcome to the Talking HealthTech podcast. My name is Peter Birch. I'm here at Digital Health Festival 2025, and I'm here with Dr Jamie Phillips from Updoc. G'day, Jamie. How you going?
Yeah, very good, Pete. Thank you, mate.
It's great to be here. And look, if by way of any of this pre-conversation we've had has any indication on how this episode's going to go, I'm excited for this discussion. So with that preamble, I'd love to hear more about your background and a little bit about you and what you do.
Yeah, so as we just chatted before, Dr Jamie Phillips, you can tell by my accent, I'm originally a Pommy.
Yep.
Now a very proud Australian. I'm a rural and remote doctor with subspecialty training in emergency medicine. So what does that mean? I'm a country rural doctor, but I specialise in ED. I look after anything that comes through the door, but in a low resource remote environment. Bit of a circuitous route getting there. Never planned to do that at all.
They're always the best journeys, I think.
Well, they're the most fun, aren't they? We never, best laid plans never survive, do they? But yeah, I spent 20 years in the military, 17 of those in the British military as a commando. So working within elite military units deployed on operations and providing remote medicine as a GP, but also providing that emergency medicine retrieval and resuscitation. Did that for 17 years and had a life-changing experience, to be frank. Brilliant. Real opportunities to disrupt, try things differently. We always say that war is a crucible for innovation, and health is no different.
Yeah. I need some help bridging this gap between that world, the military world, and then here at Digital Health Festival with Updoc. And then what's that middle? I can bridge that in my mind, but they feel like two quite different worlds that we're talking about.
Yeah, they do. I mean, there's a lot of beards here, so there's always a lot of beards around.
We are in Melbourne,
it is. The coffee's better here, definitely, than it is at war fighting. You'd think the two worlds are totally different.
Yeah.
But actually, the reality, the longer I spend in health tech and digital health, the similarities are huge. I mean, it's all about having a bold mission. So like I said to you before, the real turning point for us in Afghanistan, because to be frank, from a clinical perspective, we were losing the war. People were dying not because we did anything wrong, but we were unaware of where we could do things better. We didn't have a culture of failure, and we didn't have a culture of embracing failure. And then around 2008, 2009, we started seeing lots of IEDs go off. And that totally changed the battle that we were fighting. We were seeing injury patterns we'd never seen before, casualty rates that we just couldn't contemplate, to be frank. And we realised what we were doing was not working. And these were people's lives and their disabilities were in the balance. So we had a very bold leader, and he turned around and he said, right, 6 months, I want 0 preventable deaths in Afghanistan. And we all looked quite shocked, and he said, and I'm happy for you to fail in that. But we have to have this growth mindset. We have to be willing to fail if we're going to do something remarkable and save some lives. And he held us to account. And so I was surrounded by a very remarkable group of people with great leadership and a demand and a need that needed to happen. And we took chances and we took risks, and we looked at a systems-based problem to solving a complex problem. And we were doing that in a huge geographical area, using technology that nobody had ever been used before in healthcare, repurposing technology, using the beginnings of data analysis and machine learning. And the key thing was underpinning it with audit and governance. And people always think, military, and particularly the commando world, the beards, it's not very well governed. It's the most highly governed part of the military, because without governance, you can't take risks.
Well, I was just saying, when you say, take risks and it's okay to fail, they're not phrases you hear generally in healthcare, because sometimes failure can mean death. But I guess there's a lot of different lenses you can take on that approach to things, and I guess failing in the right areas. But then, you were talking about the importance of governance underpinning all of that. So you can do both the innovative paving new paths while also keeping that strong governance pathway?
Yeah, spot on. I mean, I'm a bit old and grey now, and as a result, I think being experienced and being a specialist is just making lots of mistakes in a very narrow area. That's the reality of what it is. That's how you become experienced. And as you get grey like me, you realise that governance equates with freedom. I talk about big paddocks, but with high fences. And if we put in a governance framework around what we're doing in digital health, it's robust, it's auditable, it's dynamic, and it's owned by us, but also owned by the patients and potentially by the regulator. It means you can be remarkable. You can innovate safely within a robust governance system. The problem, I think, and everybody's passionately agreeing with it here, we have no digital health governance system at the moment in Australia. There isn't one. And all of us are passionately asking to be regulated, which I think is a fascinating area to be in when you're in an innovative space like this. But the conversations I'm sure you've had and I've had is everybody is saying, we want to be regulated, but we want to be regulated in a way that has governance that is fit for purpose, but fit for the rate of acceleration that's happening, and will cover all of those future eventualities we're going to have.
Tell me more about that, the yearning, the desire to be governed, because is that the inherent desire for patient safety, or is it more about organizations can innovate if they know the direction they need to go? And if we're continually kind of circling and not have clear guardrails on which directions to invest in, you could go down a particular path and invest in infrastructure and capability and all of this, and then you might find out in 6, 8, 12 months that, well, that's all right, but technically it's not aligned with the correct standards and process. Like, what drives that yearning for really strong governance in telehealth?
I don't want to give a politician's answer. I actually want to give you a real answer, but it's two parts. The first part, 100%, is patient safety. Nobody gets into healthcare to harm people. Hippocratic oath, isn't it? Do no harm. And that's where we start, is we must keep patients safe. That's physically, but also morally. We need to think about having a clear moral compass about what we're doing, and that's part of patient safety. Just because we can do something doesn't mean we should. And then if you're happy that you're keeping patients safe, you then focus on quality. And I'm really keen to work with consumers, patients, regulatory bodies to understand what good looks like in virtual care in 2025, 2026, 2027. How do we measure good? How do we measure high quality? Because then if you know what good looks like, you know what not good looks like as well. And once you've sorted that, then yes, you're spot on, Pete. It's then about saying we're keeping people safe, we're delivering high quality, excellent care. We can now really innovate and push the envelope and really try to do something different. Because you see it in warfighting. The main reason people get harmed is they have decision paralysis.
Yes. Yeah.
They're in a situation where they're overwhelmed and they freeze. And when I first came to Australia in 2025, I thought, great, retiring from the British military, was in the Australian Army for 3 years. And as I started to work in rural and remote medicine in Australia, I realised that we had decision paralysis. And I suddenly started to get this odd sensation in my tummy. I think I've seen this before. Different environment, different context, uniforms were a bit different. But I realised that we were suffering from decision paralysis in digital health. As a rural doc, digital health is part of what we do. It used to be on the radio, then it was on the phone, and now with Starlink it's on video. But we just, I have to go not to swear, but there's a phrase which is JFD.
Yes, yeah.
Just do it.
I like that one.
Yeah, and that's almost where we need to be. If we can have really safe governance that keeps patients protected, morally protects us and the patients as well, we can just JFD it.
Yeah.
Let's fail fast and just give it a go, because what's the worst you can do? Fail. And you said failure is not embraced in healthcare, but that's in tech it is.
Yes.
I work for a business. The reason I joined them was because I knew the two founders, Cliff and Dylan. They'd come from Uber, and they had this growth mindset innately. They'd come from Uber where it was all about failing. And I spend most of my time with the leadership team working out how we failed, how we can fail faster, and what we've learned from that. And that's the drive that I have every week with the executive team is, right, let's go fail. Let's go and find out how we fail and fail more, because we know we can do that because it's so well governed. We're not going to harm patients.
Love that. And so it has been, I'm reflecting on the last conversation I had with Greg from Updoc, and it's been a bit over 12 months ago, I think it was. We learned a little bit more about the work that's being done there. In terms of those that might have only seen on the periphery, what does that day-to-day, the services you provide to patients, just so I can give more context to the conversation as well, in terms of what Updoc does, particularly nowadays in 2025, and what patients are asking for as well?
Yes, but I mean, Updoc's got a phenomenal growth. I mean, I joined them just over 6 months ago. I joined them because I was actually a customer of theirs. I was a customer of theirs, and I thought, wow, this is something special. And I had that little thing where I thought, this is quite a remarkable business. The product they were delivering, simple, unscheduled primary care in the virtual care environment. But what I loved was the absolute focus on doing something different and doing it safely and being willing to take measured risks. And so when Cliff and Dylan approached me and said, do you want to join as Chief Medical Officer, I bit their hand off. I jumped at it. After having promised my wife I would never do a startup again.
Gotcha.
What did I do? Straight back into a startup. But it's a brilliant business. And we're on a very clear path to create a AI native digital health platform, primarily focused on unscheduled primary care, but maybe in other areas in the future, and try and close that access gap that I see every single day in my practice as a rural generalist and an ED. Because I see so many people come into my ED and the first thing they do is apologise. They say, Dr. Jamie, I'm so sorry I'm here. I have a great GP, I just can't get to see them. Right. And I want to close that access gap, but I also want to close it for all Australians. And as a rural doc, we all know you go 2 hours outside a capital city, healthcare is a different thing. Yeah. And we've got these pockets of excellence in the capital cities, but we've also got pockets of clinical excellence in the country. And traditionally it's been the country people are supported by the city doctors. I actually want to flip it with Updoc and say we've got these brilliant rural physicians out there as well, and I want the city people to be supported by these brilliant rural physicians that they don't even know exist.
Yeah. Well, that unlocks so much potential, and I've spoken to so many clinicians who I think you were saying before, especially someone who's failed many times in a really particular area, and there are remarkable clinicians globally that I guess in theory that if you had that network of, the access to every expert in every part of healthcare and in the pocket of your hand, then the concept is remarkable, and I guess the technology exists to do that, and there's the willing few trying to band those people together. So exciting future there. Something we were talking about and touched on earlier as well is applying that model to different parts as well. I think you spoke a little bit earlier to me before around Updoc for Business. Tell me a little bit more about what that is.
Well, it's similar to a role I was doing before, which is a pure B2B business in tech. And there is a real appetite, I think, in Australian business to give their employees a meaningful benefits program.
Yes.
And certainly one of the key things that I hear all the time, and we actually get really responsible businesses coming to us at Updoc and saying, we would love to give our people access to virtual general practice because they're at work, they can't access care when they're at work, and we're going to lose some time from them. If they have to go to a face-to-face appointment, we will lose them, they'll be taking sick days. Is there a way we can facilitate that where we can keep them in work as long as they're healthy, but give them access to virtual care funded by a responsible employer? And because we don't bill Medicare, it's costing the taxpayer nothing.
Yeah.
And funded by a responsible citizen. So for me, that's a win. And I think it's also an opportunity for businesses to take a bigger role in solving this complex access block problem we have. And you'd be surprised the businesses that are keen to do it. Really, really forward-thinking leaders and forward-thinking businesses that are keen to look at, could we obtain access to your service for our employees and all their families, so they can actually focus on being effective at work rather than trying to schedule a face-to-face appointment.
It's dangerous for me to hazard a guess without having any prompting, but I typically think about those types of programs with the very large enterprise institutions, perhaps in finance and other areas. Is that the types of organisations that would look to then partner around the Updoc for Business?
Yeah, I think that's the natural fit. But there's also businesses you'll be surprised. Quick service, restaurants, etc., are very interested. And it's also businesses where they have a young cohort who really haven't had the opportunity to take their healthcare seriously and haven't engaged with healthcare, but still have health needs and feel slightly disenfranchised with the existing system. They're IT native. I talk to my children. I can't ring my children. I just have to chat with them. They're not going to take a phone call from their dad. And that's what it's trying to do, is break down access block for people, but for all Australians.
Yeah.
I'm really passionate because I think if you live in a capital city, you do all right. And we've seen patients in over 90% of postcodes now in Australia, and we've driven that a real focus for us is reducing the waiting times for all Australians, but particularly for our rural and remote communities.
Yeah. I'm super interested to know, as we're closing out Digital Health Festival and I guess this conversation too, given your unique perspective and the lens that you've taken and your experience and I guess the parallels that you can draw from one industry to another, you've been up on stages and you've spoken to other innovators and clinicians and everyone here at Digital Health Festival. Where do you see the ball going in terms of healthcare? Because historically, as you've seen too, in the past, there's a lot of talk about what we could potentially do in healthcare, but often the day-to-day kind of feels about the same. I regularly talk about how I wear my health tech innovation hat, here for the podcast. Then I go into my GP clinic who still doesn't do online appointment bookings and all this kind of stuff. They're just, the chasm is huge sometimes, but there are pockets where it's starting to close. But there is this, I'm not sure if it's Stockholm Syndrome or whether it's something else, where it does feel like within healthcare right now, all the kind of stars are aligning and we are seeing real kind of direction and excitement in terms of innovation and innovative care. So where do you see the ball going in terms of healthcare technology and how that ties in with virtual care and all the other bits and pieces?
I think we'll go back to the military experience thing, really. As I said, war was a brilliant accelerator for health tech and health innovation and digital health. And that was great right up until the war ended. And we forget those lessons really, really quickly. And I draw those parallels with the COVID pandemic. COVID pandemic was fantastic for accelerating digital health, removing unnecessary governance and unnecessary red tape, but also driving the introduction of rapidly of technologies, the adoption of them, but governing them as well. My biggest fear is now we don't have the impetus for change, i.e. a COVID pandemic, the rate will slow. The desire to change will slow. When you said, on the panels, it's brilliant. Yes, there's people who agree, but there's also really passionate detractors. I took incoming up on the stage, and that's brilliant. Because just because I say it doesn't mean it's true.
Yeah.
And I want to be robustly questioned. I want to be robustly challenged. And we need to be having those conversations, but we need to be having them in public.
Yeah.
And we need to be transparent and we need to have those relationships faithfully. So I think my number one priority is we need to start talking to each other within the traditional face-to-face model, as you said, with your GP, within the innovative digital AI-driven models like Updoc. But we also need to be talking with the regulator and the patient, because we need that patient voice at the table. You said as a patient, I want this and I can't get it.
Yeah.
You should be empowered to be able to get that. So that would be my first thing. The second thing is governance. We need a robust digital health governance system in Australia that is agile and fit for purpose. We don't have it, so we can't innovate because we don't have the high fences. We've got the big paddocks. Big country, isn't it? Yeah. But we haven't got the high paddocks. And then I think the final thing is just developing a growth mindset. You said it. We've got to be willing to fail. Fail safely, because that's why you get governance in there. But we've got to be willing to fail. We've got to give it a go and just JFD it.
I feel like that should be the subtitle for this episode is just JFD. So, Jamie, I've loved this conversation. We should be speaking a lot more, and I'm sure we'll hear you on future episodes of the Talking HealthTech podcast. Make sure you check out the Updoc listing on our website to learn more and check out previous episodes. Matt, I really appreciate your time.
Appreciate it, Pete. Thanks, mate.